going to work, flying on an airplane, eating in a restaurant, hosting a birthday party, attending a church service in person. Just some of the things that many of us have not been able to do with our family and our friends for several weeks now due to government prohibitions while we deal with the spread of COVID-19. So when we emerge, what will we have learned and how should our recovery look? Amy Cooke is the CEO for the John Locke Foundation. She joins me now to talk about a look ahead as we move ourselves out of this unprecedented situation. Amy, welcome back to the program.
Hey, Donna. Thanks so much for having me.
We have heard the president talk a lot about looking ahead. And here in North Carolina, we are waiting, at least as of the time you and I are talking, for Governor Roy Cooper to make some statements about what will the future look like and how will we roll out this reopening of North Carolina.
Boy, that is so true, Donna. The state budget director has come out and said, I know this won't shock anyone, that if we aren't already in a recession, we're headed towards one, as if that's something we couldn't all feel.
Right.
But I think for those of us, what are we in? Days. Every day seems the same now.
Because as someone told me, March has lasted forever.
Yeah, right. You're right. However long we're into this, and at least the earliest we would look at reopening the North Carolina economy on any level is April 30th. Now, you would think that if we're looking ahead to April 30th, that our governor would have at least something in his mind about how we phase in reopening. And Carolina Journal actually asked the governor that question, and it's a legitimate question. I think it's a question we all have. We're talking about it right here, right now. How do we reopen? We're looking at it, if it is April 30th, we don't know. But if it is April 30th, which is the way it stands right now as we are talking about it, it's a few weeks away, but there has to be some kind of a plan. And Carolina Journal asked that of the governor, and it wasn't that he said, listen, I'll have something, or he didn't say, you know what, I'm not ready to make that public, or we're having those conversations, they're in the early stages. He simply didn't respond at all. And it's been, I think, it's been probably almost a week since that question has been posed to him, and Carolina Journal followed up, and then asked, "Listen, did you even get the email?" This is a legitimate question to ask of the chief executive of our state.
Well, it's on everyone's mind.
Right.
People are. My impression, Amy, is that people are more than willing to do their part to try to stop the spread of this. It's serious. We haven't seen something like this before, but we are seeing people that starting more and more to talk about it. In the case of Carolina Journal, to ask important questions about where is the balance and what is the end game. At least what is the measure by which we will say, okay, this metric, we've now reached it, and therefore stage one of recovery begins.
Right. When can we start phasing in certain businesses? And I think, and at what point, what is the tripwire, like you said, what's the tripwire? When have we flattened the curve enough to where we can start talking about being safe at work rather than shutting down a business? So here's how you can be safe while working. We don't have to shut you down. It was interesting. The mayor of Chicago got a haircut. Literally got how?
And can I have access to that person?
One of the hot spots of the country, and her point was, I'm the face of our city. There's truth in that. But the person who cut my hair wore a mask and gloves. Okay.
Makes sense.
Great. We all agree. If that will keep the mayor, the chief executive of Chicago, safe, can't the rest of us start doing that very same thing too? She was being safe while getting a service. We can do this. But again, what is that tripwire, and when do we start seeing the flattening of the curve? Coming out with those, and these models, Donna, they're all over the place. So part of it is, what is a tripwire? Well, which model are you going to follow? You're going to follow the one that has tens of thousands of people dying. You're going to follow the one that says, you know what? I think when you practice safe social distancing, when you're wearing a mask and when you're wearing gloves, or you're doing all the things you need to be safe, can we flatten that curve and keep and reopen the economy? We cannot continue like this for too much longer.
I had a conversation by text, not in person, conversation by text with someone who is a small business person, and it's a one-person operation, and he was asking me, well, I guess I need to look into this whole federal action, and will I be one where I can actually get a lifeline to try to keep my business open because he can't do anything. He's considered non-essential. And I said, you need to check out the rules and all that. And so after we texted about that, he then texted, even if I'm eligible for the federal lifeline money, as he put it, that's not what I want. I just want to go back to work.
I just want to work. There's also, it isn't just the financial aspect of it. It's also just sort of the, it's like the almost mental health aspect of getting out of your house and going to work. There is there's that, confidence that comes from working, earning a living, putting food on the table for your children. I was listening to the Wall Street Journal. They have a podcast every morning. I was listening to that, and they're talking about possibly putting more money into that SBA, that lifeline, because much of it's already gone, and there are people that tried to get it that couldn't.
The Paycheck Protection Program.
Right. Mm-hmm. Couldn't get it. And so now they're making hard choices on, do we lay people off? I mean, we're at a very critical phase right now. Chief executives have to come out one way or the other and let folks know. Are we going to start phasing in opening? Can we reopen and practice safe social distancing and being safe? I think we can. We're Americans. We can do a whole lot of things. One of them is getting back to work and doing it safely, because we're all concerned about our health and our families and everything.
Absolutely. And as we await more information from Governor Roy Cooper as to what his administration's plan might be to open up North Carolina again. We know, Amy, based on the research done by analysts here at the John Locke Foundation, that we're better off than most states when it comes to opening the doors back up and being able to handle what could turn out to be critical needs in the meantime, because we've got roughly $3 billion cushion here. Not that we want to spend all that now, but if we have to, we can.
Right. We do have money. One of the things that we're going to have to watch out for, and it's not just North Carolina, it's a whole bunch of states, but it's that delay in tax revenue.
Yeah.
So getting
big time impact.
Right. And getting through to June 30th, which is the end of the fiscal year. Will we have to do something to backfill that, and then it's not available for next year? I think you're going to see like you said, North Carolina, thanks to the excellent leadership at the state capitol, at our state legislature, they budgeted wisely, they budgeted prudently, and that's why we have some cushion. And yes, we are in a better position than many other states. Still, we're going to have to look at the budget carefully.
Amy Cooke is the CEO of the John Locke Foundation. By the way, you can follow her on Twitter and on Facebook at
The Right AOC.
Yeah, you got that right. The Right AOC. Amy Cooke, thanks so much for joining us.
Thanks, Donna.